Hi everyone, I'm Dr. Shirazi, a board certified dermatologist. Welcome back to my YouTube channel. Lately I've been getting so many questions about procedures and treatments that help tighten the skin around the eyes. I get a lot of patients that come into the office and they say, I have this crepey skin, I have this loose skin around my eyes, what can I do? Even younger people are asking about what they can do about lines and just to firm up that skin around the eyes. So I thought I would make a YouTube video about procedures and treatments that help tighten the skin around the eyes. Before we get started, don't forget to rate, review, and subscribe, and share this with a friend who might be interested to hear what dermatologists and plastic surgeons recommend for tightening that skin around the eyes. So first of all, that skin around the eyes is thinner, it's more delicate, so it's more susceptible to UV damage. And the biggest factor in collagen loss, honestly, is UV radiation. UVA and UVB will penetrate the skin and break down collagen, elastin, and result in looser skin. So the more sun exposure, the less protection, the more crepey skin, the looser the skin gets, and the faster it gets loose. So that's really, really important. And a lot of people forget to even pay attention to protecting that skin from the sun. So first and foremost, make sure that you're applying a sunscreen or a sun protective product. I love EyeGlow AM, which has SPF 50. It's mineral based, which means it has zinc and titanium in it. And it has a peptide serum that comes out and hydrates the skin. I use it to depuff my eyes in the morning, but you can also use like lip balms with SPF because that skin is more sensitive and more delicate. A lot of people complain about their skin reacting, their eyelids stinging from sunscreen. I personally love this product because it's also a concealer and it has a little cooling tip with it. So first and foremost, protect what you got. So what can we do in the office? Really, there's three main categories of treatments that help tighten the skin. Because of the structure around the eyes and the eyeball itself, you can't use some of the things that we use on the body or other areas of the face around that eyelid skin. It's much more delicate, it's more difficult. So number one is radiofrequency and ultrasound. These are categorized as skin tightening treatments. They are non-invasive, they really have zero downtime, maybe a little bit of redness, but there's really no recovery because the radiofrequency or the ultrasound actually goes deep into the skin. So when we're looking at skin tightening, we want to consider all the skin layers. We want to look at it holistically, right? You don't want to just tighten the top part of the skin. We want to sort of address all the layers and help tighten the structure in all the layers of skin. So we're going to start kind of deep and below the dermis. So the radiofrequency penetrates and causes an injury using heat that then triggers this wound response. And wound responses help stimulate new collagen, new elastin. So when you have this done, it takes about 2 to 3 months to see the results. But you may have heard some of these devices, Thermage, Ultherapy, Excelus is the one I love and the one I use because it has radiofrequency and ultrasound. And so these technologies produce varying degrees of tightening. It works the best, honestly, in people that are younger. So in your 30s and your 40s is really the prime time for you to start doing these skin tightening treatments. You're going to see the best results over time because you're able to generate the most collagen when you're younger. Because as we age, our skin produces 1% less collagen starting in our 20s per year over time. So you want to catch this technology early on. I personally love Excelus. It feels like a hot massage treatment. It's a little uncomfortable. It gets kind of hot, but it's not painful. Ultherapy, I find it to be very painful. Softwave uses ultrasound. So there's lots of these devices on the market. And like I said, there's variable improvement. It takes some time to see it. Number two, fillers. So we use hyaluronic acid mostly around the eyes. That's the safest filler that you can use. And filler placement does stimulate some collagen over time, but it's important to use fillers only if you have volume loss, because as we age, starting in early to mid-30s is when most people start to lose these essential fat pads around the eyes and the brows and the tear trough or under eye area and the medial cheek area, temple area. So these are the areas that we start to see volume loss. So when we use fillers to replace volume, it also stimulates collagen. I personally find EyeGlow, which uses a white filler blend, and it has calcium hydroxyapatite as a component to stimulate the most collagen, the good kind of collagen, type 1 collagen, which is found naturally in our dermis. So I find EyeGlow to not only be volume restoring, but also help stimulate collagen in the skin. And number 3, laser resurfacing, particularly ablative laser resurfacing. There's really 2 categories. There's the non-ablative, which are technologies like Halo or Fraxel that don't really do much to the surface of the skin, but the laser beams penetrate into the dermis, into the deep dermis, to stimulate collagen and elastin and trigger this wound healing and bring in new fresh skin that's healthier, tighter, with more collagen. So I favor ablative laser resurfacing because I feel like it gives you better improvement in texture, a better job is just overall tightening the skin. Now it does have more risk and more downtime, but the results are more dramatic. So I like erbium that's fractionated, or even full field if you have a lot of loose skin, and then a fractionated CO2. We can literally see the skin pulling tight when we're using these technologies. Now they are highly specialized, and it's a high risk area because of risk of damage to the eyeball. It's really important that your doctor knows how to operate these lasers, understands the laser skin interaction, and uses internal metal shields to protect the eyeball, because that laser beam can be very harmful to the eyes. Now the recovery can be quite long. You can have open, oozy skin for several days, up to a week. Usually the skin heals over at 7 days. And you want to make sure you follow a very strict protocol of skincare with your doctor, because the aftercare is almost as important as the actual procedure in optimizing your healing and your results. Now, the skin heals over at 7 days, but it can take 2 to 3 months for that skin to really pull tight, because even at 7 days, you might still have some swelling, you might still have some redness after a laser resurfacing. So you have to be patient and give it some time, but there's really nothing that compares to the results that we see from laser resurfacing. Now there's this new technology called Elocore, and that is not a laser. It's basically, it almost looks like a machine gun, honestly. It's like this rapid fire. It looks very graphic and really kind of scary. It's really loud, and it goes in and it removes micrometers of skin, and then it allows the skin to kind of heal in with new fresh skin production. So it does require local anesthesia, but a lot of times I also use local anesthesia for my laser resurfacing. I'm not really sure about that technology. It's relatively new. It's been on the market, I want to say, for about a year, but I know some people at Harvard, like Dr. Matthew Avram, that uses this technology. So it's still relatively new, and so I still favor laser resurfacing if you have a lot of loose skin, you have a lot of that crepey skin. There's really nothing that compares. I mean, look at these before and afters. And so they're great for lighter skin tones. We can also treat darker skin tones, but there's a great risk of hyperpigmentation, and that hyperpigmentation can last for a really long time, and it can be difficult to remove hyperpigmentation around the eyes because that skin is so sensitive. So a lot of times bleaching creams and things can really irritate it, but we can use lasers like IPL to help lighten the hyperpigmentation. But definitely darker skin is much more challenging to treat with laser resurfacing, particularly around the eyes, because of that risk of hyperpigmentation. So ideally you want to use I call it the cold laser, which is the erbium laser. and not the CO2, because the CO2, although it causes a lot of tightening because it causes what dermatologists call coagulation of the skin, and that's when we see that skin pull tight, it can cause prolonged redness and hyperpigmentation if you're darker skin. So I hope that was helpful, guys. Be safe. You never want to use things like threads or Sculptra around the eyes. That is just a disclaimer. I don't particularly like doing microneedling in that area, especially in older patients, because I feel like that's a really risky area. It can cause some tears and some trauma to that skin. I don't find it to be as elegant. All right, guys, thanks for tuning in, and share this with a friend who might also be interested. You can find me on Instagram and TikTok. Until next time.